Hello students, I am the OGGuru Dr. Punit Bhojani here with a single point agenda to make OBGY your most favorite subject, most scoring subject. Now very important video, most expected images for the upcoming June examination. I had done a similar video for the Jan exam and 3 to 4 images from that video had come in the FMGE exam in the January. Same thing will happen. Feel free to get in touch with me on phone and WhatsApp on this number for your guidance and timetable. And revise your entire OBGY in just 2 days under my guidance. Whichever source OBGY studied from, don't worry at all. All of you know OBGY is the single most important subject. 30 to 35 MCQs are going to come. And my dear students, your score is going to jump up. And just use the code OG special and just in 600 rupees. Just in 600 rupees. The package is going to be valid till your exam. More about this later on. Everything will be covered. FMGE PYQs, NEET PG PYQs also. And just revise the entire OBGY. So many students get stuck up at the score of 135, 140. Then they take my lectures. And because of this, their score is going to jump up. If with your current knowledge, you are getting 10, 11, 12, 13, 14 MCQs incorrect just in 2 days time, my dear student, 2 days time, your score in OBGY can jump up to 25, 28, 30, 15 marks more. When you will walk out of FMG examination, you will tell me, thank you sir, among all 19 subjects, best performances in OBGY. Feel free to get in touch with me. OG special is a special discount coupon code and let us begin. Now, what is the mode of delivery in this case? So what happens moment the students see this case, they start applying the twin scar rule, and what will you do? Anybody? Now, all of you look on the board. What is the rule? Okay, so the route of delivery is decided by the position of the first baby. Isn't it? So the position of the first baby. Now, which is the first baby? One which is up or one which is down? Okay, so all of you please pay attention. The one which is up. The one which is up is not the first baby. That is the second. The one which I feel on PV examination is the first baby. Is it clear to all of you? So, यहाँ पे क्या है sir? This is our first baby and this is vertex, and therefore many of the students will mark, hey sir, we will go for vaginal delivery. Wrong. Why wrong? Because please pay attention. What is the difference in this? Yes, now all of you, I'm coming back to the answer in 1 minute. ध्यान से सुनेंगे. Now all of you look on the board. This rule what I told you, okay, route of delivery decided by the position or presentation of the first baby. This rule is for which one? So the rule is for DCDA twins and monochorionic diamniotic twins only. Like in this picture, we can see two placenta, two different chambers. So sir, this is DCDA and this also is DCDA type of twin. Now यहाँ पे when you see, yes, this is our first fetus because that is what I feel on PV. This is our second fetus. Here sir, the first fetus is in vertex and therefore this I will try. Vaginal delivery is possible. VD is my short form for vaginal delivery. But, so here, the first baby all of us can see is in breech and therefore this goes for LSCS. So ये दो एक के साथ दो image free. Okay, so this is there. But as I told you, this rule is only for DCDA, MCDA. What will I do in monochorionic, monoamniotic twin? Yes. Sir, MCMA, moment you rupture the membranes, both cord prolapse, both babies can die, and during labor, both cords can get intertwangled among themselves and both babies can die. Therefore, MCMA, once it is there, we are not supposed to check the baby ka position. Whatever may be, let both be vertex, both be breech, answer is LSCS, and this is a difficult. You can see this is only a single placenta and a single amniotic chamber. So my dear student, this is a googly, this is MCMA twin. Yes, the first baby is vertex, second is also vertex, but you can see there is no dividing membrane. Can you see? Is it clear? So otherwise what would have happened? There would have been a dividing membrane. Okay, if there is a dividing membrane between the two twins, then baat alag hai. There is no dividing membrane. This is a single placenta and single amniotic chamber. MCMA is the twin and therefore it is always LSCS. We don't do external cephalic version. And twins, you know, MCMA hai. Remember, MCMA always goes for LSCS. Is this understood to all of you? Please comment in the chat box among all these which is the most common variety. Please comment in the chat box which is the most common variety and what radiological sign do we get in DCDA. क्या radiological sign है and what is the radiological sign which I see in MCDA. Please comment in the chat box. I'll give you the answer over there. Tell me the radiological sign. What is the sign which will tell you that sir this is a DCDA twin and this is a MCDA. Then the two names of the sign very important. So MCA में always LSCS याद रखना है. एक के साथ तीन पिक्चर हमने आंसर किया है. This is the answer LSCS. This sir first baby breach again LSCS, but sir this is first baby vertex. We'll go for vaginal delivery. Any combination could be asked to in the exam. Thoko tali clap. Now this pattern is seen in what? Now moment this first understand this, my dear student. Is this NST? No, clean gold. This is CTG, cardiotocography. Why? We are seeing two graphs. Upper is the fetal heart rate. Upper is the fetal heart rate. Lower is the contraction, uterine contraction. You can see. So during contraction, the pressure increases. So there's like one contraction, two contraction, three contractions. They can ask you. Okay. Now we can clearly see the heartbeat is dropping down. Isn't it? Heartbeat is going down. So what is the type of deceleration? And this pattern is seen in which condition? Now all of you please pay attention. If you closely observe the graph, very important, surely coming in this year's exam, what is happening is we are seeing a mirror image. What is the meaning of mirror image? Please pay attention. Sir, when the contraction starts, the heart rate starts to go down. When the contraction is over, the heart rate has recovered and the peak of the contraction is also corresponding to the lowest part. This is called as nadir. क्या बोलते हैं इसको? Nadir. Peak and nadir are corresponding. This is a mirror image, and whenever you have mirror image, this is early deceleration. This is early deceleration, and early deceleration is seen in which condition? Yes, sir. Early deceleration is seen in head compression. Cord compression, we get variable deceleration. And please comment in the chat box. Rupture vasa previa. What virgin pattern? Virgin MCQ. Ruptured vasa previa में क्या pattern दिखेगा? Please comment in the chat box. Very difficult. I'll answer you over there. And uteroplacental insufficiency, we have late deceleration. Okay. So please understand this. Again, I repeat. So contraction starts, heartbeat starts to go down. The peak of the contraction and the lowest point nadir are corresponding, and contraction over, heartbeat has recovered. Same thing is happening again and again. So this is early deceleration which we get in head compression when the baby's head touches the pelvic floor. Simple याद रखना है कि sir, when the heart rate is going down like this, when the heart rate is going down like this, and correspondingly if you have a graph like this which is like a mirror image. Okay, so mirror image याद रखना है. Mirror image is telling you early deceleration which is seen in head compression. So with this one question, they're asking you double question. Okay, is this understood to all of you? Identify this Mullerian anomaly. Now, moment students see these two uteruses, they will say, okay, sir, this is bicornuate uterus. Isn't it bicornuate? Wrong. Wrong. Why? Because you are also supposed to see that there are two cervixes. It's a complete duplication. We are not only seeing two uteruses, we are also seeing two cervixes. And therefore, this is one more difficult MCQ. Okay, which Mullerian anomaly can be identified in the OPD just by per speculum examination? Yes, this one. Okay, if I do a per speculum examination and if I see two cervixes, if I see two cervices, cervix subpleural cervices, this is didelphus. Uterine anomaly, didelphus. This is a didelphus uterus. Remember this. Okay, so didelphus hai because two uterus and two cervixes seen on per speculum examination. Didelphus is the answer. Please understand this, that your bicornuate uterus, okay, Bicornuate uterus will have a single cervix. बात समझ में आ रहा है? Yes, the bicornuate uterus will be having a single cervix. Okay, so when you have one cervix and two horns. Okay, we have two horns, one horn, second horn. This is bicornuate. Is it clear to all of you? So unicornuate, bicornuate, there is a single cervix. Okay, single cervix and two horn. Single cervix and two horn. That is our bicornuate uterus. Is this understood to all of you? And very difficult virgin MCQ. So this died first because I can see two services. Very difficult virgin MCQ. All of you can see the HSG also. Now please understand this. Septate uterus, bicornuate uterus, HSG I have shown you before also. Okay. This is a special condition where two cannulas. Yes. Can you see? Sir, ye ek cannula is going in one. The first cannula is going in one cervix. And second cannula is used, so you require two cannulas to do it, and then you will see two separate horns. So same thing. इसी का is didelphus का image, like a pictorial representation, and this is what hysterosalpingography, what it is showing. Same thing, sir, didelphus uterus. Because sir, we are seeing two horns. This triangle, this is a cavity. Okay, these are two horns. Okay, two horns or two uteruses, two uterus. Okay, two things are seen, and basically even two cervix. You can clearly see there are two cannulas used. There are two cannulas. Please comment what is the cannula used. What is the cannula used to perform HSG? HSG is a test for tubal patency. By the way, we can also come to know about Mullerian anomalies. Okay, and please comment in the chat box. Okay, sir, HSG is a test for tubal patency, which is the best investigation for tubal patency. Gold standard for tubal patency kya hai? Please comment in the chat box, and also tell me bicornuate uterus. How will it apply? How will it look? Yes, sir. Two horns wide apart. Two horns wide apart agar hai, and we will calculate the, yes. By the way, if they ask you to differentiate, okay, we are supposed to calculate this angle, and if that angle is a obtuse angle, it will be a obtuse angle. That is a bicornuate uterus on HSG, but single cervix. Okay, single cervix. Okay, let all of you. So keep this in mind. This is a very difficult virgin IBQ. This will be coming after 2-3 years. You will remember me. Thoko tali. Okay. Now identify this procedure. Please understand this. Here we can see a stitch. But what is this stitch? And what is this for? Yes. So sir, this is a encerclage operation. Encerclage ya cerclage ya os tightening. Os tightening is done for what? Yes, sir, cervical incompetence. When the cervix is weak, cervical incompetence, what do? We have to put in a stitch. Cervical incompetence, what is the clinical feature? Typically repeated second trimester abortion, but very important, it is painless. Please comment in the chat box cervical length criteria. What do we call it as a short cervix? Less than how much centimeter, and when it is a short cervix, it is an indication to do a encerclage operation. Now here what is done is, please pay attention. So this is the uterus, this is the cervix. So it is weak, the cervix is weak, and therefore we go round and round. We go round and round, and we put a cerclage, encerclage or os tightening. Two names we are supposed to remember. One Indian, one imported. McDonald and Shirodkar. McDonald and Shirodkar, encerclage surgery. Okay, Shirodkar was asked just last in the June examination, very likely to be repeated this year. McDonald will come, and that's why this is for all of you. Kaise differentiate karna hai? Yes, directly if it's a purse string suture, what we do is, so this is the cervix. We take a bite from 12 o'clock. You can see from here. So this is going from here, then it will come back from here, then it will come out from here, and then it will come out from here, and we tie a stitch. Isn't it same thing you can see over here is being done over here? Knot is taken from here, then you come back from down, then this and this. Okay, and then we tie a knot. So this, my dear student, is McDonald encerclage. McDonald's encerclage. When you tighten it, the cervix. Okay, it is to be taken with a non-absorbable suture material. Shirodkar में क्या difference होगा? Please understand this. A tape is used. A Mullerian tape होगा. We make a nick over here. It is higher up. Shirodkar is still higher level. The bladder dissection is done. Okay, all these details they will not ask you. So generally क्या होता है कि the McDonald is somewhere between the external os and the internal os. Okay, McDonald थोड़ा सा lower level पे होता है, and Shirodkar is still at a higher level. Remember this. Okay, McDonald is slightly at a lower level. Shirodkar is at a higher level, PG level. Okay, PG MCQ. Okay, मतलब क्या है higher level का मतलब कि you will have to dissect the bladder. So in Shirodkar, you will see a nick, a bladder is dissected. Okay, bladder is dissected and we use a tape. Generally, a Mullerian tape is used and submucosally we go and we put the tape. So you'll see a bladder dissection. Okay, so here the bladder has to be dissected upwards and thoda sa bladder dissection is required. All these details they will not ask you, but just remember कि थोड़ा सा at a higher level you will see. Okay, so when you see कि sir यहाँ पे cut is made, bladder is being retracted upwards and the tape is higher up and a tape is used, that is your Shirodkar. This is McDonald. Simple purse string suture. You can see like a purse string. You can see purse string suture, which is their cerclage. Okay, so this is McDonald encerclage. Keep this in mind. Very important, ये भी past में आया है, ये क्या है? Yes, so this is a uterus and whenever we have a atonic PPH, postpartum hemorrhage, this is a balloon tamponade, a balloon. And what is the name of this balloon? Yes, बकरी बलून. बट माय डियर स्टूडेंट, क्योंकि ये फॉरेन का माल है. ओके, तो बकरी नहीं बोलना है. कैसे बोलना है? बैकरी. स्टाइलिश कैसे बोलेंगे? रिपीट आफ्टर मी. बैकरी. So when you say this, आपका जॉ थोड़ा सा ड्रॉप होना चाहिए. बैकरी बलून, बैकरी. Okay, one more MCQ. What it is what is the capacity of this balloon? 500 ml. What is the principle? It's a tamponade. Okay, balloon tamponade. Okay, to control the bleeding. India में this was copied, our idea was copied. India में we use condom tamponade. Okay, condom can also be used. What is the logic? So if this is the uterus and after delivery it is not contracting, what is done? So a red rubber catheter is taken, a condom is tied on top of it and this is connected to a saline. So the condom will inflate and this will control the bleeding. So this is a condom tamponade. Okay, so if you see a condom, you can say a condom tamponade. This is a balloon, so this is a bakri balloon tamponade. It's a ready-made catheter is there. Catheter mein there is a valve over here with which you push in saline and 500 ml is the capacity of this. Okay, and remember this one very important MCQ. When does this condom tamponade or balloon tamponade play a role? Yes, when the medical management fails. Okay, if they give you in the exam, so medical management has failed and we have to now proceed for surgical management. उसके बीच में ये balloon tamponade plays a role. Very, very important. Okay, so balloon tamponade का role, they can ask you this also was there. Patient has PPH, the medical management has failed, and what do we go for next? Balloon tamponade or condom tamponade. Bakri balloon tamponade, bakri balloon tamponade. 500 ml is the capacity of the balloon. All these are very important MCQs to be kept in mind. Identify the maneuver and what is the purpose. पहले तो नाम. So दो questions आ सकते हैं. What is the name of this maneuver? Now here we can see the baby being delivered. Nothing special about it. What is this? Yes, this hand is giving perineal support. And what is it? We keep on. Now please understand this. Baby's head is flexed. Barabar? Baby's head is always flexed. The baby's head is flexed. And the head delivery will take place by extension. Yes or no? So the head delivery will always take place by extension. But what I want is, I want a gradual extension to take place. There's a rapid, there's a fatak se extension, there's lots of perineal tear. So this, my dear student, is the Ritgen maneuver. Very, very important. Ritgen maneuver. And the purpose is to prevent Perineal tear. That is the answer. The purpose is to prevent perineal tear. It is not done in cases of fetal distress or prevent a head injury. It is to prevent perineal tear. Basically, what it is Ritgen maneuver. Okay, I want, yes, extension is going to happen. Extension hone wala hai, but head delivery by gradual extension. Okay, gradual extension. You keep on maintaining the flexion. You keep on maintaining the flexion. So there's a gradual extension. It will prevent all the perineal tears. Is this understood? To prevent PPH, what do we do? Yes, sir. To prevent PPH, we do something called as AMTSL, active management third stage of labor, giving a uterotonic agent. Is this understood to all of you? So this identify the image aa sakta hai. This is a Ritgen maneuver and it is nothing great. It's like head delivery but by gradual extension, and the purpose is to prevent maternal injury and perineal tears. Is this understood to all of you? Okay, and my dear students, look at this beautiful notes. Absolutely crisp, completely color, and every student has told me, okay sir, once we have seen your videos, we can revise the entire note in 2 hours time. I myself, there's a notes read along session where along with the students we have read the entire notes in absolutely just in 2 hours time, completely colorful. There are students who have told me, yes, after my paper 1 was over, in the break time I read your notes and every question was from your notes. And my dear student, you can read every question directly from the lecture what you have told me. OGGuru, thank you very much. Best app, thank you very much, sir. I will carry these lessons to my life. And OGGuru ne exam OBGY ne bacha liya. Pura credit aapko the student. I couldn't have passed the exam without this. Okay, and you can see second half, sir, seeing the questions all came from your notes. Is understood to all of you. Same thing will happen with you, my dear students, when you walk out of the June FMGE examination. Message me, call me, and sir, all questions were from your lecture. Just 2 days time. Whichever source OBGY studied from, this is a MCQ based RR. I'm going to cover M. They're going to be quizzes where you will be giving the quizzes. There are MCQ discussion videos detailed. There's a quick theory rapid revision videos also. PYQs of not only FMGE, NEET, PG, PYQs also are most important and you have to do it, and I'm going to cover it for you. All the clinical MCQs, virgin MCQ. If this 30-minute session was useful to you, imagine that just in 2 days time, just give 2 days, you can revise the entire OBGY, 30 marks. It's a single most important subject. Your score in OBGY from 10, 11, 13, 14 is going to jump up to 28, 29, 13 to 15 marks more. OG special is a special coupon code. This code is hidden. Type this code before payment. The price will only become 600 rupees. 600 rupees. Download the OGGuru app. Life changing hai. It's going to help you pass the FMGE examination. Okay, recorded lectures you can see anytime as per your convenience. Validity will of course be for 2 months till the date of your FMGE examination. So 30 to 35 questions worth cover hone wala hai. MCQs, theory, beautiful handwritten notes, IBQs, clinical case, everything is there. And do not forget to subscribe to the YouTube channel. Please share this video with all your friends and colleagues. Hype ka option aa raha hai, to hype button daba dena. Follow us on Insta also. Lot of interesting comment, and Telegram pe iska PDF will be available. Bye bye. Best of luck. Thank you very much. And of course, get in touch with me on phone and WhatsApp on this number. Thank you.